Welcome to The Explainer. Today we're diving into a story of incredible pressure and, well, resilience. We're going to look at how Israel's healthcare system, a system already known for its efficiency, coped with the unimaginable crisis that unfolded after the October 7th conflict. We'll be drawing on some really powerful first-hand accounts and expert analysis to see what happened on the ground.
All right, so here's how we're going to break this down. First, we'll get a handle on the system's foundation. Then, we'll look at the human impact, this idea of circles of vulnerability. After that, we'll go to the front lines of care, tackle the huge mental health crisis that followed, see how people innovated under intense pressure, and finally, wrap up with the key lessons in resilience. Let's get started.
Okay, so first up, the system's foundation. To really get a grip on how a system responds to a crisis, you first have to understand what it was like before the storm hit. So what was the state of Israeli healthcare leading up to this moment? Well, it turns out the system was already a bit of a standout. The World Health Organization basically said it performs better than average on most key indicators. And get this, it's known for being incredibly efficient. We're talking top-tier care, great health outcomes, but at a cost that's way lower than many other developed countries. So you've got this high-performing, efficient machine, and it was about to be tested like never ever before. So what makes it tick? It really comes down to a few core ideas. First, you've got universal coverage. Everyone's in, and you get to choose from 4 different nonprofit health plans. The benefits package is really broad and clear, covering everything from your local doctor to hospital care. But here's the kicker, and this is super important for what comes next. There's a huge emphasis on community-based primary care. That local connection, that bedrock, would prove to be absolutely crucial when things fell apart.
All right, so we've got this efficient system on paper. But how does a system like that actually deal with the immense human impact of a crisis? Public health experts were scrambling to even conceptualize the scale of the trauma, and they landed on this really powerful model to help them understand it.
It's called the circles of vulnerability, a model described by Professor Dorit Nitzan. The best way to picture it is like throwing a stone into a still pond. There's the initial splash, but then you see these ripples, these concentric circles expanding outwards. That's exactly what trauma does. It doesn't just hit one spot. Its effects ripple out, touching more and more people.
And here's what those ripples actually look like. At the very center, that first circle, you have the direct victims, the people who were wounded, kidnapped, and their immediate families. But look at the very next circle out. It's the community. It's the neighbors and friends who suddenly became first responders. Then the circle gets bigger, affecting the entire region. And finally, it expands to touch the entire country and even the global diaspora. It's a shockwave, plain and simple.
And this quote from Professor Nitzan really nails it. She says, "The care for those in the immediate circle starts with the community." Think about that. The first lifesavers weren't necessarily paramedics in an ambulance. They were neighbors. The communities themselves were the first line of defense, the first to provide both physical and emotional first aid. This is such a critical point.
Okay, so you have this massive, rippling wave of need. How on earth did the healthcare system actually handle the sheer number of casualties on the front lines? Well, it turns out we saw 2 very different models of care spring into action.
Is really a tale of 2 models. On one hand, you have the giant Soroka Medical Center. This is a massive, centralized Level 1 trauma center that ended up treating the largest mass casualty event from a terror attack ever recorded in a single hospital. Just wow. And on the other hand, you have a totally different approach to REM urgent care. This isn't one big hospital. It's a distributed network of over 30 smaller clinics. Their strength wasn't size, it was agility.
Now, just try to put yourself in this situation for a second. Dr. Shlomi Kodesh, the CEO of Soroka, is in his hospital. They've already dealt with an unbelievable number of casualties, over 4,000. And then the room shakes. He says it was clear a missile had hit nearby, and he had no doubt it was aimed at the hospital. I mean, can you even imagine? How do you command your staff to keep saving lives when the very building you're in is under attack? It's just an impossible challenge.
And while that was happening at Soroka, the other model, Term's Agile Network, was showing its own kind of strength. I mean, listen to this. Hannon Krantz, their southern director, described how staff at one clinic had to lock themselves in a safe room for 12 hours. But they didn't stop. They rapidly expanded hours where they needed to, and they even opened up brand new temporary clinics inside hotels to treat families who'd been evacuated. They brought the care to the people. And through it all, their incredibly diverse staff, Jews, Arabs, Christians, Muslims, they all worked together. So you have these incredible heroes treating the physical injuries, the visible wounds. But at the exact same time, there was another crisis, a quieter one, ripping through the population.
We're talking about a tidal wave of psychological trauma, the invisible wounds of this conflict.
Right. So what about the invisible wounds? How do you even begin to quantify that kind of national trauma? Well, researchers started to dig in, and the numbers they came back with, they are absolutely staggering.
This chart just lays it out in black and, well, blue and red. It's stark. Look at this. Data from Professor Yuval Nuria's team shows that before the attack, about 16% of the general population had probable PTSD. Just 1 month later, that number had nearly doubled. It shot up to 30%. That's an incredible jump in such a short amount of time.
But digging deeper into that data reveals something that might surprise you, and it's a really critical finding. The risk for PTSD wasn't spread evenly. For Israel's Arab citizens, the risk was over 50%. That's more than double the risk for the Jewish population. And while they weren't the direct targets of the attack, Professor Nuria explains that this isn't unusual. Global research often shows that minority communities can be at a higher risk for mental health issues after a mass trauma.
So you have this mental health crisis of just epic proportions. The existing system, well, it was completely buckling under the weight of it all. The big question became, how do you possibly scale up to meet a need this huge, this sudden? A huge part of the answer came from a specific type of therapy called EMDR. It stands for Eye Movement Desensitization and Reprocessing. Now that's a mouthful, but the basic idea is that it uses things like guided eye movements to help your brain's own natural healing system get unstuck. It helps you process traumatic memories so they don't have the same emotional power over you. It's a really powerful tool. But here's the bottleneck. It's great to have a therapy like EMDR, but you need people trained to actually do it. And they just didn't have enough. So Dr. Danny Kahn and his colleagues took on this absolutely massive task. They trained over 600 new therapists in EMDR. Think about that. They basically had to build an army of mental health first responders, and they had to do it fast.
And this quote from Dr. Kahn really gets to the heart of what it takes in a crisis. He had to make this incredibly hard choice to stop seeing his own patients, to stop the one-on-one healing, because he realized he could have a bigger impact by teaching. It was a personal sacrifice, right? But he knew it was the right call, because as he said, we need more people. It's the classic teach-a-person-to-fish dilemma, but on a national scale with immense stakes.
Okay, so let's pull all these different threads together. We've been in the massive trauma centers, the small agile clinics, and inside the therapy rooms. What does it all add up to? What are the big lessons we can take away from this response?
A few really powerful themes just jump right out. First, we saw it from the very beginning. The community is the real first line of defense. Second, we saw incredible innovation happen at lightning speed, especially in mental health, because it just had to. Necessity truly was the mother of invention here. Third, none of this would have been possible without that solid universal healthcare system already in place. And finally, something truly inspiring, this idea of unity in diversity, with people from every background working toward one mission. It paints a picture of incredible resilience, for sure, but it also reminds us that the road to recovery is going to be very, very long.
Which brings us to this final question, and it's a big one. When a nation is tested like this, where does that resilience really come from? Is it the system, the community, the individual? And I think what this entire story shows us is that the answer isn't A, B, or C. It's all of the above. And more importantly, it's about how they all connect. True resilience seems to come from that sweet spot where a strong system supports a connected community, and that community empowers the incredible individuals on the ground to do what needs to be done.